Hi everyone, this is Dr. Mike once again and welcome to my channel. Previously, we've discussed about coronavirus and the proper way of hand hygiene or steps in hand washing, the difference of alcohol and hand sanitizer. This time, we'll discuss about the medical face mask. Mga kababayan, pag-usapan po natin ngayon ang tungkol sa paggamit ng face mask, ang tamang paraan ng paggamit ng face mask. Alam ko, marami kong questions, marami kayong katanungan kung saan ba at paano gagamitin ng tama ang face mask. WHO only recommends the use of face mask in certain cases. These special cases are patients or individuals who have cough, who have fever, who have runny nose, and difficulty. So yung pong mga pasyente na may lagnat, fever, difficulty of breathing, nahihirapan huminga, sinisipon or runny nose, at inuubo nga, so sila po yung nangangailangan ng face mask na kailangan din ninyo na mag-seek ng medical help or professional help sa inyong mga doktor. However, if you are healthy and taking care of a patient suspected or infected with the new coronavirus, then you need to wear a face mask. I repeat po, kung kayo po ay nag-aalaga ng may sakit na new coronavirus or ibang klaseng sakit na hindi nyo po alam kung ano po siya, kung bacteria or virus siya, kailangan po ninyong mag-wear ng face mask. Remember, dapat po combination po o gamiting pareho ang nabanggit kong procedure. Tamang paghugas ng kamay at tamang pagsuot ng face mask para po maprotektahan ang ating sarili. We need to have knowledge about this coronavirus and the proper way of hand hygiene and the use of face mask. So marami pong salamat, and if you like this video, please like and subscribe sa video po natin. Hanggang sa muli po, thank you so much and see you next time.